Welcome to Module 7, Part 3. In this part, we will overview the transcription of features associated with nasality, nasalization, nasal emission, and lack of nasality, or denasality. If you recall, when we talked about vowels, we discussed how the quality of the vowel changes before nasal consonants. Typically, the velum lowers early, prior to the oral closure for the nasal, and air begins to flow through the nose prior to the consonant. The nasal airflow changes the quality of the vowel and it becomes nasalized. We transcribe nasalization of vowels using a wavy line called a tilde above the phoneme symbol. Sometimes only a portion of the vowel is nasalized, and sometimes the entire vowel is nasalized. You may also have nasalization occurring following a nasal consonant in the syllable onset, but it is less common. Let's listen to the difference between nasalized and non-nasalized versions of a vowel in the minimal pairs pet and pen and pat and pan. Listen. Pet versus pen and pat versus pan. In each pair, you should hear that the vowel sounds different before the nasal consonant. Notice that I also used the raising diacritic for pan. It's fine to use more than one diacritic on a symbol if that's what you hear. If two diacritics are supposed to go in the same place, you can just stack them on top of each other, or next to each other. Nasalization is an important feature to recognize because it is very common in some speech disorders. For example, in the speech of clients with cleft palate and possibly in the speech of people with hearing loss. Let's listen to an example of the speech of a child with a cleft palate. In this case repaired, but the child was still undergoing speech therapy. Listen for the nasalization of vowels where it would not normally occur, that is, in syllables without nasal consonants like light, strikes, drops, air, they, and act.
When the sunlight strikes raindrops in the air, they act.
There are issues with the consonants in this speech sample as well, and we will discuss how to transcribe some of those issues in the next slide. As you heard in the speech sample in the previous slide, excessive or inappropriate nasal airflow causes issues for consonants as well as vowels. For nasal airflow on consonants, we use a different symbol than the one we use for vowels, however. To indicate that there is nasal airflow on a consonant where nasal airflow should not be present, we use the symbol for nasal emission or nasal escape. Note the spelling, it is emission, not omission. The symbol for nasal emission is the tilde that we use for nasalization of vowels, but with two small dots, one on the top right and one on the bottom left. Let's hear an example of speech where we might use this symbol. Here is the phrase again.
When the sunlight strikes raindrops in the air, they act.
Let's listen to just the word strikes. The first phoneme has no fricative to it, so I decided to transcribe it as n. In the second S, you can hear some frication, but also a sort of snorting noise that indicates nasal airflow.
Strikes. Strikes.
Here's another example. It's.
It's. It's.
In this example, you can again hear some frication on the S, but also the airflow through the nose. You may also hear nasal airflow in other consonants than fricatives, such as stops and affricates especially, in clinical examples. The next diacritic indicates the opposite of the nasal emission diacritic. It is the diacritic for lack of nasality. Lack of nasality occurs when nasal airflow does not occur when it should. That is, when there is a lack of nasal airflow for a nasal consonant. Lack of nasality should make a nasal consonant sound more like a stop. Again, if you think a stop completely substitutes for a nasal, then just transcribe the stop. But if the phoneme is in between a stop and a nasal, you can use the lack of nasality diacritic. We transcribe lack of nasality by using the tilde that we used for nasalization over the phoneme, and then putting a slash through it to indicate the expected nasality is not present. Lack of nasality may occur if a client is congested or if there is an obstruction in the nasal cavity. Here are some examples. No versus do versus do. No, do, and do. To get used to transcribing these allophones and remembering the context in which they occur, complete the relevant exercises in your textbook. This is the end of Part 3.